Oba Dr. Alade Lucy Ogunlade Aladetoyinbo, CFR, Odundu II, the Deji of Akure Kingdom. You are welcome, sir. We have with us the chairman of CAN in Ondo State, Reverend Father Anselm Ologunwa, ably represented by the Vice President of CAN, Bishop Ayodeji Akomolafe. Bishop, I recognize you, sir. I'll use as a point of respect to all the members of the State Executive Council who had earlier been recognized. Dr. Professor Simidele Odimayo, Prof. I'll use it as a point of respect to all ESCO members here. We have members of Ondo State House of Assembly. You are all welcome. All our chairmen from the 18 local governments of Ondo State, all LCDA chairmen, I recognize you. Let me use as a point of respect to all the heads of security agencies, the Comptroller of Customs, Ondo and Ekiti State Command, CC Moreni KG Bewaji. Mommy, I'll use it as a point of respect to all our heads of security agencies. I all recognize you. Wowikan, I recognize all the members of Wowikan. Iyalaje, Iyaloja, Gbogbo Ogba. Members of NURTW, I recognize you. Top government functionaries in the house. All our students, we are all welcome to save the time of our First Lady. I recognize us, you are all welcome. Student body, representative of NANS JSCC Ondo State. Are we in the house? Great Nigerian student of the greatest of Nigerian students. You are all welcome. National Association of Ondo State Students. I recognize you all. Solidarity forever. Solidarity forever. Solidarity forever. Thank you. Let me recognize this morning Dr. Ahmed, CMD FMC Owo, Professor Olusegun Ojo, CMD Futa, Dr. Akambiemu, Permanent Secretary, Ondo State Primary Healthcare Development Agency, Dr. Abiodun Oyeneyin, Director General, Contributory Health Insurance Agency, Pharmacist Ayegbusi, Executive Secretary, Ondo State Drugs and Health Commodities Management Agency. We are all welcome. Dr. Ayodele Adiji, Permanent Secretary, Ondo State Hospitals Management Board. Dr. Niron Ikuomola, Permanent Secretary, Ondo State Ministry of Health. All the members of 41 in the house, I recognize you, ma, and I greet you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you very much. You are all duly recognized and welcome. Please let me also recognize the coordinator of the Renewed Hope Initiative in Ondo State, Dr. Sheung Bosede Osamaye. Please celebrate her. Celebrate her. Dutiful, hardworking, resilient, and indeed a good representation of Renewed Hope. Thank you very much for all you do. God bless you. Because of our time, we need to move faster. And now it will be time for the address of welcome to be said by the First Lady of Ondo State, Her Excellency, Mrs. Esther Oluwaseun Ayedatua. Please put your hands together as Her Excellency comes to the rostrum for the address of welcome. Thank you very much. Please, once again, do understand that we do not appreciate any phone recording whatsoever. Please. Thank you.
Thank you. Let's have our seat. Thank you. Thank you. The First Lady of the Federal Republic of Nigeria, Her Excellency, Senator Oluremi Tinubu, CON, National Chairman, Renewed Hope Initiative. Also in our midst we have the wife of the Vice President, Her Excellency Ajia Nana Shetima. Also the wife of the Deputy Senate President, Ajia Laila Barau. The Governor of Ondo State, my husband, Dr. Lucky Orimisan Ayedatiwa. And I would like to use this opportunity to wish us happy wedding anniversary. Thank you for celebrating us. Also, I would like to welcome all the first ladies in the house. Thank you. Thank you. The first ladies in the house, Ekiti First Lady, Her Excellency Dr. Olayemi Oyebanji. Also the First Lady of Osun State, Her Excellency Chief Mrs. Titilola Adeleke. Oyo State First Lady, Her Excellency Engineer Tamino Minini Makinde. Also Lagos State First Lady, Her Excellency Dr. Mrs. Claudio Ibijoke Sanwo-Olu. Ogun State First Lady, Her Excellency Mrs. Bamidele Abiodun. Gombe State First Lady, Her Excellency Ajia Asmau Yahaya. Jigawa State First Lady, Her Excellency Adiza Umar Namadi. Kaduna State First Lady, Her Excellency Ajia Absef Uba Sani. Borno State First Lady, Her Excellency Dr. Farmat Umaru Sulum. Nasarawa First Lady, Her Excellency Ajia Silifat Abdullahi Sule. I would also like to recognize the presence of the Deputy Governor of Ondo State, Dr. Adelami and the wife. You are welcome. I would also like to welcome the Honorable Minister of State, Health and Social Welfare, Dr. Isiaq Adekunle Salako. Also EDCO, National Primary Healthcare Development Agency, Dr. Muyi Aina. I recognize the wives of the ministers present here. Also Senator Adeniyi Adegbomire, Senator representing Ondo Central. The wives of senators and member of House of Representatives. Wives of security chiefs, using the wives of the National Security Advisor, Ajia Sarah Ribadu, as a point of contact. All the Executive Council member of Ondo State. Member of the press. And please permit me to all other protocols are duly observed. I feel greatly honored and privileged to have yet another opportunity to welcome our mother, the First Lady of Federal Republic of Nigeria, and wife of the President, Her Excellency Senator Oluremi Tinubu, CON, to our dear Sunshine State yesterday. Thank you, ma. We are here again to witness another flag off to empower the initiative of the women of the Southwest geopolitical region. Your Excellency, we are generally excited by the rare privilege to have you with us in Ondo State, for 2 good days, in spite of your very busy schedules and occasioned by pressing national issues. Mommy, you have demonstrated to us the peak of magnanimity and unwavering commitment to national building. We are indeed very grateful for your love for us as women. I would also like to, Excellency, as the mother of this great country, and we are grateful to you and your esteemed entourage for your perseverance and uncommon love for our dear Sunshine State, and indeed the entire Southwest region. I would also like to appreciate my sisters, the first ladies from all the states that are here, and those that First Lady has visited in other geopolitical zones. Thank you. God bless you. Today, we gathered again to witness the official launch of another landmark of Your Excellency, Free to Shine, a triple elimination campaign against HIV, syphilis, and hepatitis amongst women of reproductive age, elimination of mother-to-child transmission, and treatment of Nigerian born with HIV/AIDS in Nigeria. The laudable initiative will no doubt expand the frontier and benefit of the Renewed Hope initiative. I wish to emphasize that the incredible initiative marks a significant milestone in our collective effort to protect the health and well-being of the citizen. Sincerely appreciate that the launch of this campaign today is not merely a target of diseases. You are also empowering women and girls to take control of their health. Those diseases, HIV/AIDS, syphilis, and hepatitis, pose significant threats to the health of the women of reproductive age. They have devastating and often fatal consequences if not well treated. This also includes mother-to-child transmission and long-term health complications. Your Excellency, by your rare show of ingenuity, you are leading us on a journey towards a brighter future, a future where every woman and child can live a healthy and fulfilling life. We want to also assure you that the fight against these dreaded diseases is not your fight alone. It is the fight of all well-meaning Nigerians. particularly our women. And this is our women who are at the center of Renewed Hope Initiative. We must also stand with Your Excellency and the fight. We must win together. Permit me to make a clearing call to all stakeholders, public-spirited individual, healthcare provider, community leaders, and indeed all Nigerians to collaborate with our mother in this mobile fight to make our society safer, healthier, and more meaningful. This is a new era, one where we have a caring mother leading from the front to free us from shackles of these avoidable diseases like HIV, syphilis, and hepatitis amongst women of reproductive age. On behalf of the entire Southwest region, I want to express our profound appreciation to you, Your Excellency, for your deep sense of innovation, dedication, resilience, and commitment to ensuring a brighter, healthier, and safer future for us, our children, and communities. You are indeed a caring mother and the mother of our nation, Nigeria. Let me also express my profound appreciation to my husband, His Excellency Lucky Orimisan Ayedatiwa, the Governor of Ondo State, for his various initiatives, policies, and programs which prioritize the welfare and growth of women and girl child, and for providing an enabling atmosphere to host the memorable event of our dear state, of our dear Sunshine State. I also thank all the good women of Ondo State for turning out massively for this event. Finally, I wish Your Excellency and your esteemed entourage a safe journey back to your various destinations after the ceremony. Thank you all. Long live Nigeria. Long live Ondo State. Thank you, and God bless.
Thank you very much, the First Lady of Ondo State, Her Excellency, Mrs. Esther Oluwaseun Ayedatiwa. We appreciate you, man. Ìyá ni ìyá wa, ìyá tí ó lábà wọ́n rárá. Ìyá tí ó lábà wọ́n rárá o. Ìyá ni ìyá wa, ìyá ni ìyá wa, ìyá tí ó lábà wọ́n rárá. Ìyá ni ìyá wa. Ó dà tiwa, ó dà tiwa, ó dìrọ̀rùn. Thank you very much, Ondo State women. We appreciate you. God bless you. Your Excellencies, distinguished guests, ladies and gentlemen, let me quickly run through the list of health MDAs that I have with me under the supervision of the Special Advisor to Mr. Governor on Health, Professor Simidele Michael Odimayo. We have the board member, Hospitals Management Board, permanent secretaries and staff of the Ministry of Health, Hospitals Management Board, Primary Health Care, DG of Ondo State Contributory Health Scheme, Executive Secretary, Ondo State Agency for the Control of AIDS and Staff, Nigerian Medical Association, NMA, Ondo State Chapter, National Association of Nigerian Nurses and Midwives, Ondo State, Pharmaceutical Society of Nigeria, PSN, Nigerian Union of Allied Health Professionals, Young Medical Laboratory Scientists Forum, all the nurses and midwives, lecturers of the Faculty of Nursing Sciences, University of Medical Science, Ondo, lecturers of Peacock College of Nursing and Midwifery, Akure, lecturers of the Ondo State Community Nursing and Midwifery, lecturers of the Ondo State College of Health Technology, and last but not the least, lecturers of the Millennium Health Technology, Akure.
Thank you very much. Please celebrate, celebrate, celebrate. Your Excellency, the First Lady of the Federal Republic of Nigeria, Your Excellency, the Governor of Ondo State, with your kind permission, we need to move ahead now. Please, let's note that the next thing is the general overview of the Free to Shine campaign by Dr. Nados Bahanan, Executive Secretary, Organization of African First Ladies for Development. We will be taking that via a recorded video that will be played to us, and then we will listen to that address, the general overview. Please let Dr. Adebobola Basharon, the Director and National Coordinator, NASCP, be getting ready for the presentation on the status of eliminating vertical transmission of HIV, syphilis, and ending pediatric AIDS in the Southwest geopolitical zone. Please, we implore you all to pay rapt attention as we now listen to the general overview of this program. Thank you very much. God bless you. Thank you very much. That's the general overview of the Free to Shine campaign as delivered by Dr. Nados Bahanan. Thank you very much. Please, let's celebrate her.
Moving on quickly on today's program, I'd like to invite for the presentation on the status of eliminating vertical transmission of HIV, syphilis, and ending pediatric AIDS in the Southwest geopolitical zone by the National AIDS and STDs Control Program. Dr. Adebobola Basharon is the Director and National Coordinator, NASCP. He'll be stepping, he's right beside me. A warm round of applause for him. Thank you.
Her Excellency, the First Lady of the Federal Republic of Nigeria, Senator Oluremi Tinubu CON, wife of the Vice President and National Vice Chairman, RHI Hajia Nana Shetima, His Excellency, the Governor of Ondo State, Dr. Lucky Orimisan Ayedatiwa, and the First Lady, Her Excellency Mrs. Esther Oluwaseun Ayedatiwa. All First Ladies are present, members of the RHI Governing Council, and my minister, my boss, Dr. Ishak Adekunle Salako. Her Excellency, the First Lady, permit me to stand on the existing protocol for the others. So this screen, is the screen on? So this is the 5th Free to Shine campaign that we are doing in Nigeria, led by the First Lady. And this is the map of the south of Nigeria, showing the Southwest and the 6 states. And the basic principle is triple elimination of HIV, viral hepatitis, and syphilis. The idea is to ensure that no child is infected going forward. Next. And as we know, HIV stands for human immunodeficiency virus, which affects the immune system of the human being. It's caused by a virus. Currently in Nigeria, we have 1.9 million Nigerians living with HIV, and out of these, 67,000 are children. In 2024, there are 9,000 new infections, which dropped from 14,000 before 2023. Approximately 42,000 women are currently in need of intervention for prevention of mother-to-child transmission of HIV. Syphilis itself is another disease which is caused by a bacteria, a microorganism, that can affect pregnant women and cause dangerous effects on children, such as neonatal deaths while in pregnancy, congenital deformities, and preterm deliveries. It can be screened for and can also be timely treated during antenatal care and to avoid critical implications. Hepatitis itself is also another organism that causes hepatitis B infection. It is estimated that in Nigeria, 8 in every 100, that is 8%, have hepatitis B virus. While in rural areas, it's higher, with 11 to up to 12 people in every 100 Nigerians. We need to strengthen screening to avoid liver complication of these diseases. Next. The Free to Shine is a game changer. It has been launched by HOFLAD and led by Our Excellency Senator Oluremi Tinubu CON to aim to eradicate mother-to-child transmission of HIV, syphilis, and hepatitis B in Nigeria. It requires a comprehensive and integrated maternal and child health service approach. It focuses on prevention, testing, treatment, and care for women, newborns, and their families, strengthening health systems for quality service delivery, and engaging communities in this initiative. This is ably led and championed by Nigeria's First Lady, a quintessential maternal and child health advocate. So as a country, as Southwest region, because we've done this in the other 4 regions, where are we? Currently, based on the National Health and Demographic Survey conducted every 5 years in Nigeria, the last one was released last year, we have 63% of all our pregnant women attending antenatal care, while 37 do not or look for unskilled personnel to help them in the antenatal. For those of the 63%, 83% report if services in PMTCT, that's prevention of mother-to-child transmission. 8% did not report, and 9% of this total did not offer PMTCT. Also, as a country, where are we? It is recommended by WHO that a pregnant woman should attend at least 4 antenatal care or clinics during the pregnancy of 9 months. For a country like Nigeria, currently we're at 52%. Only 50% of our women attended 4 or more antenatal care visits. Within the last 1 year of this administration, which of course Renewed Hope Initiative is driving, we've been able to move the testing of pregnant women from 36% in 2023 to 67% in 2024. Also, the PMCT treatment coverage, that means giving HIV antiretroviral drugs to women that are positive to prevent transmission, has also increased from 33% in 2023 to 63% in 2024. Though we've made some progress, there's need to close the remaining gaps. Free to Shine, with our first ladies there present, will help to facilitate this awareness and actions to close these gaps. Now, specifically focusing on the Southwest, the next chart. Looking at the DHS report for Southwest, Osun State has 93% of women receiving antenatal care from skilled providers. 7, that is, the 7 that shows 7%. So for every 100 women, 93% attended, 7 did not attend for Osun. For Lagos, 93% attended, 7 also did not get antenatal clinic from skilled provider. Ekiti, 90 attended, 10 did not. Ogun, 86, 14. Oyo, 83, 17. Ondo, 80, 20. While for the national average looks at the entire geopolitical zones, the 6 of them, the national average is 63% had service of antenatal care, while 37 did not. For a country like Nigeria, our target is 95% to have antenatal care services, while the remaining 5 will try to handle them in such a way that we can even meet them to 99%. Also, for those that have at least 4 antenatal care visits during their pregnancy, Ekiti has 68.6%, that means 68 out of every 100. Lagos, 95% had at least 4 visits. Ogun, 73, Ondo, 66%, Osun, 92, and Oyo, 73.8%, which is 74%. Now, coning it down straight to HIV and syphilis prevention or treatment. 65% based on the facility records, program record, 65% were seen and tested in antenatal care clinics in Ekiti State, while for the program itself is 98%. It means almost everybody that came to the clinic were tested at 98%. But 65% here is telling us among the general public, when you go to the community and you look at everybody, it is 65%. And 68% of those that need the treatment, that's the yellow bar, are placed on treatment for prevention of mother-to-child transmission of HIV, syphilis, and hepatitis. Lagos, 41% in the general population had ANC testing, while 99% of those that came to facilities were tested. 43% are put on treatment. Ogun is 48, 80, 37. Ondo is not a coincidence because we're in Akure, is not. Ondo is 91%, 95%, and 97%. 97% means for those that need HIV treatment for prevention of mother-to-child transmission, Ondo was able to put 97% of them on treatment to prevent that transmission. Please, let's clap. For Osun, it is 77, 96, 46, while Oyo is 88% among the general population were tested. 87% of those that came to facilities were tested, and 95% of those that are positives in Oyo were put on treatment. Now, the approach to eliminating mother-to-child transmission for all of us to act on, we need to find all the pregnant women, test all pregnant women for HIV, syphilis, and hepatitis, provide medicines to treat and prevent transmission of these infections, and report all these services to ensure that we are adequately reporting. The plan are 2, for those that come to facilities and for those that don't come. For those that come, we need to provide adequate test kits at the antenatal care services site. For women identified as living with any of these 3 infections, they must be treated well. For women that do not attend antenatal clinic at all, we need to improve awareness, community mobilization, and access to ANC attendance, and also for treatment. NASCAP, which is the National HIV/AIDS Viral Hepatitis Control Program in the Federal Ministry of Health, is working with various stakeholders, and we have developed a triple elimination framework that we would like to roll out in line with the Renewed Hope Initiative and Free to Shine. Now, what are the key interventions in that document? Primary prevention is still key. Antenatal care, women attending antenatal clinics for the pregnancy, is still key. Prevention of mother-to-child transmission of HIV, viral hepatitis, and syphilis is key. And we definitely need to do additional care for infants, for HIV, increased nutritional level, and also services for affected partners and families. The advocacy messages are simple. We need to ask your antenatal care. For women, you need to ask your antenatal care provider to conduct HIV. Is your right HIV, syphilis, and hepatitis test. Once they tell you about your result, if you are positive, please ensure you get the result and you get your treatment. It's also your right, in line with the Free to Shine initiative. For those that do not receive antenatal care, women are encouraged, the community's members are encouraged to ensure that every single woman is linked to a place for antenatal care. And once this is done, they can be tested to prevent transmission. For pediatrics, which is also key, any child that is infected is probably to 99% assurance got it from either their parents or people in their domain. So it is our right as children to ask our parents to ensure that they take us for testing for any disease, and we also get immunized against hepatitis and any other vaccine preventable diseases in Nigeria. Generally, for everyone, it is encouraged that we should focus on the ABCs of prevention. We should still focus on abstinence, be faithful, consistent condom use, and for everyone to get tested, and if you are positive, you should be treated, either for HIV, for STIs, or for hepatitis. And of course, there can be no infection to a pregnant woman or to even a group if men is not involved, because most of the transmissions are between couples or due to sexual interaction. So men's health is also key to achieve the goal. As the women, we are promoting PMTCT. We should also ensure that the men are not infected and do not transmit. And finally, I leave with this, which is a quote from the First Lady. And the quote says, "Let us all come together and advocate for triple elimination of HIV/AIDS, syphilis, and hepatitis by 2030. Thank you very much.
Thank you very much. I was thinking that Ondo State people will be able to clap very well, especially seeing your report card. Please celebrate, celebrate. That is the offshoot of visionary leadership of His Excellency, the Governor of Ondo State, Honorable Dr. Lucky Orimisan Ayedatiwa. Your Excellency, the First Lady, Federal Republic of Nigeria. At this point, we want to take some testimonials and experience sharing by those who will be able to tell us that it's indeed not a death sentence. Please, let's welcome them.
I'd like to invite the first representative of the Association of Women Living with HIV/AIDS. I'd like you to step forward, and you have just 2 minutes. Thank you.
Thank you very much. The First Lady, our mommy, the #1 mother of the Federal Republic of Nigeria, I want to specially welcome you to Ondo State. Thank you for coming. It is a privilege in southwestern Nigeria for us to host you. Also, permit me to recognize the first citizen in Ondo State, Dr. Lucky Orimisan Ayedatiwa. Ma, kindly permit me to stand on the already established protocols. My name is Ayomide Faith Jayeola. I represent the Association of Women Living with HIV in Nigeria, Ondo State chapter. The journey started 19 years ago. In the year 2006, I was diagnosed. It came as a shock, the fear therein, and the stigma. I was seen by a suitor then as someone that was going to die any moment from that particular time. But lo and behold, here am I, waxing stronger, looking more radiant, looking more beautiful. Yes, this is to say to each and every one of us that being HIV positive is not a death sentence. HIV did not determine who I became, but I determined what to do with HIV. Yes. What did the magic? Medication. I took the medication, and today I am virally suppressed, meaning I can never infect anybody. It's you is equal to you. Why are we here today? Elimination of mother-to-child transmission. In other words, known as prevention of mother-to-child transmission. I have a story behind that. Eventually, I got married, even though it was assumed I can never. Yes, and I had 2 beautiful princesses, and they are both HIV negative. It is possible. The only thing I would like to say here, if we can do away with stigmatization and discrimination of persons living with HIV, we can win this battle. There is a campaign now, prevention of mother-to-child transmission. Every child have the right to be born HIV negative, but it depends on each and every one of us in this hall and beyond. Now, we are looking at prevention of mother-to-child transmission. We are aware of the U.S. executive order. It affected a lot of HADOC staffs, partnering with IPs, ODSACA, Ondo State government, in this state and even beyond, even in Nigeria, to see to it that children are not born with HIV. But it goes a long way. There is an aspect of it. We have pair counseling, which is mother-to-mother pair. We call them mentor mothers. The executive order affected them and every other HADOC staffs. I want to use this opportunity, sir, let's look for a way while we are implementing this project. Let's see to it that whatever happens, because we don't know what PEPFAR is going to say tomorrow, let's see how we can bring these people on board, engage them meaningfully, and then make sure they are working with us. Permit me to use this opportunity to appreciate the first citizen of Ondo State. They are helping, they are supportive. We want to bless the Lord. And at this juncture, I want to say, if I could achieve prevention of mother-to-child transmission, we can all do it. Thank you.
Thank you very much. A warm round of applause for her one more time. Thank you. I'd like to invite to the microphone, and also strictly one that we should bear in mind that time is of the essence. I'd like to invite the representative of the Association of Young People Living with HIV/AIDS. The representative of young people living with HIV/AIDS. A warm round of applause for him as he steps to the microphone. We have the representative. Thank you. May we sit. I have the representative of the young people, representative of the Association of Young People Living with HIV/AIDS.
Thank you very much, ma'am. Good morning, everyone in the house. I bring my special greetings to Her Excellency, the First Lady, and my special greetings to His Excellency, Dr. Lucky Aiyedatiwa. I am the representative of APIN, the Association of Positive Youth Network in Ondo State. The journey got started like 8 years ago. I was diagnosed. The funny thing is that even till this moment, I did not know where this infection came from, because the lab personnel then made me to realize that it's not a recent infection, that it has been in my bloodstream for a while now before I was down with the illness. So it was the idea of living with HIV alone. It's something very traumatizing. It was something that there is this self-stigmatization that I had to isolate myself from the community. I thought is a death sentence based on the society we lived in. People have made us to realize that with this virus, maybe you cannot become someone in life anymore. I began to attend more seminars, and a lot of counseling was done. I began to get my confidence back. It was something that I am really proud of. And today I am very virally surprised. I am now equal to you. And we have others, young people out there, both boys and girls, that are also living with this virus. But due to the stigma and discrimination in our society, they cannot come out. They don't have the confidence to talk about what they are going through. Even I would also employ each and everyone in this room today to please not to stigmatize people that are living with virus. I got to realize that this thing will be much easier for people that are taking ARV if there is no stigma and discrimination. The truth of the matter is ARV is not chocolate. Now that it is meat that someone will be so much excited to be taking every day, it's not something easy. So I would employ every one of us to please encourage people that are living with this virus, so they would see this virus as just simple thing like malarias and every other simple disease out there. So I'd like to also say, currently in the state, we have young people that are working with the implementing partners in the state, but based on the issue with PEPFAR, they are unemployment, and these people, if they don't have a job, there is no how they'll be able to go to the facility to assess their care, to assess their medication. Please, I would employ the First Lady and His Excellency to please do something, help us to do something about that. Thank you, ma'am.
Thank you very much. I'll request we give him one more round of applause. Thank you very much. I see the way Mama is frantically clapping for him. Thank you very much for the encouragement. Thank you very much. May we sit. Conclusively on this slot of testimonials and experience sharing, Your Excellencies, with your kind permission, I have a fantastic couple here standing right next to me. And so we're going to be listening to the experience in just 2 minutes. Thank you.
Ẹ jọ̀ọ́ ẹ gbà mí láyè láti sọ Yorùbá torí ọmọ Yorùbá ni mí àti pé àwọn tí ó ti kọ́kọ́ wá lẹ́ẹ̀kan tí bá wa yànnà náà ní English ní èdè òyìnbó. Mo kí màmá wa obìnrin àkọ́kọ́ ní orílẹ̀-èdè Nàìjíríà, màmá Olúrẹ̀mí Tinubu, ẹ káàbọ̀ mà. Dẹ́ mo kí bàbá wa olóríire ènìyàn ni, ẹni tó ní ìfẹ́ ará ìlú, ẹni tó ní passion tó dẹ̀ wà kẹrin. Ohun tó jẹ́ kí n sọ bẹ́ẹ̀ ni pé nígbà tá a ṣe World AIDS Day, bàbá fi ẹsẹ̀ rìn láti Government House dé ọjà. Mi ò tí ì rú ẹ̀rí, ẹjọ́ ẹ bá mi ṣe gbòòsà mẹ́ta fún wọn. Àyẹn fi hàn pé orí wa ti sàn àti ayé ti jẹ́ kí ni ó ti dà tiwa. Ẹ jọ̀ọ́ ká má pẹ́ púpọ̀ torí àkókò tó fún mi ò fi bẹ́ẹ̀ pọ̀. Mo jẹ́ ẹnìkan tó ń gbé pẹ̀lú kòkòrò HIV. Ó ti tó bí 35 years nísìnyí bá ṣe ń sọ. Nígbà yẹn gan ó le koko nígbà yẹn tó jẹ́ pé tí àwa bá ń lọ lọ́jà báyìí tá a bá rí nǹkan tá a fẹ́ rà ní ọjà a rí kòrókòrò wọn ní filé wa lọ́wọ́ nítorí pé à ń gbé pẹ̀lú kòkòrò yẹn torí stigma yẹn pọ̀ ń gbà yẹn lọ́hùn gbogbo àǹfààní tá à ń rí àárí nísìnyí àárí bẹ́ẹ̀ nígbà yẹn ṣùgbọ́n pẹ̀lú gbogbo àǹfààní tó tí à ń rí yẹn aṣáà ń tẹra mọ́ pé tó wá máa tó gbà kan o tá a bá ti bẹ̀rẹ̀ sí lo oògùn kí ni ó ṣe kí ni ara wa ṣe kí ni a lè kókó mo lè dúpẹ́ lọ́wọ́ Ọlọ́run pé ìyàwó mi lélẹ́yìí àti bí àwọn ọmọ tó jẹ́ pé gbogbo àwọn ọmọ mi kò sẹ́ni tó ní kòkòrò HIV nínú wọn kí ni àṣírí tó wà ń bẹ̀ ni pé èmi fúnra mi àti ìyàwó mi àti kọ́kọ́ pa self stigma a ṣe kí ni àparẹ́ so a ti ń jáde lórí rédíò lórí tẹlifíṣàn lóríṣiríṣi káàkiri ní 2007 1 September àwọn alájáde ní orí gbogbo orílẹ̀-èdè àti àgbáyé pé we are living with this HIV and AIDS pé àwọn tó máa ń gbé pẹ̀lú kòkòrò HIV wọ́n ṣe kí ni wọ́n ní ìgbé ayé àlàáfíà nítorí pé wọ́n ti mọ̀ ohun tó ń bẹ ní àgọ́ ara wọn wọ́n lè ti mọ àwọn nǹkan tán lè gbà tán lè fi dojú kọ fìdí nìyẹn tẹ́ fi ṣe pé àwàláyé dòní ohun tá à ń sọ fáwọn èèyàn ni pé kòkòrò HIV ò pààyàn mọ́ o tí ọba ti bẹ̀rẹ̀ sí lo oògùn wa déédéé oògùn yẹn kò sí àkókò fún wa torí pé mo gbé dání lẹ́ẹ̀kan bẹ̀ kò sí àkókò fún wa tó bá tó time kan bóyá ní women affairs bóyá wọ́n fún wa láyè láti wá yìnbọn náà dáadáa ṣùgbọ́n fún àkókò òtún fún wa báyìí ẹ jẹ́ kí a máa tá bá ti lo oògùn wa déédéé kò sí nǹkan kan tó fẹ́ ṣẹlẹ̀ iṣẹ́ tí oògùn yẹn ṣe ni pé kò ní jẹ́ kí kòkòrò yẹn kó ṣe kí ni kó yé sí mọ́ gbogbo tó dẹ̀ ti bàjẹ́ lágbo ara máa ṣe kí ni a máa túnṣe ní àárọ̀ tẹ́ ẹ bá tètè dé lé mi tẹ́ ẹ bá tètè wá mi wálé ní àárọ̀ ẹ lè bá mi lé kí ló dé torí pé mo ní okun ara ju àwọn tí ò ní kòkòrò HIV lọ gbogbo àwọn ọmọ tí mo dẹ̀ bí gbogbo wọn ni kò ṣe kí ni wọn ò ní so ohun tá à ń try láti sọ ni pé kòkòrò HIV ń wà níta o ó ń jà rìnrìn ṣùgbọ́n kò pààyàn mọ́ tí èèyàn bá ṣe kí ni tó bá ń lo oògùn ẹ̀ déédéé ẹ dẹ̀ bá mi dúpẹ́ lọ́wọ́ àwọn minister of health àdórí saka lórí lọ́wọ́ Dr. Adékùlù àwọn ni mentor mi àti mentor ìyàwó mi a dúpẹ́ pé iyì ló jẹ́ fún wọn lọ́jọ́ òní láti lè máa sọ bẹ́ẹ̀ni iyì ló jẹ́ fún wọn ní ọjọ́ òní láti lè máa rí wa báyìí tí wọ́n rí wa nínú ìwòlẹ̀ tí wọ́n ò ṣe pé wọ́n ti gbàgbé wa kán máa sọ ìtàn wa a dẹ̀ dúpẹ́ fún àǹfààní tó fún wa lọ́jọ́ òní ẹ ṣé gan.
Please celebrate them, celebrate them. In essence, what this couple has said is that HIV/AIDS is out there, but then it's not a death sentence. He has also said that indeed it's even stronger than people who are not living with the disease. He has also said that today, if you are looking for him and you do not come early, you not meet him in the house because he has gone out to do his daily business. And so he has encouraged that everyone should be aware and should know that it is not a death sentence, but you must always use your medication and appropriately. Thank you very much. Please let the Director General for the National Agency for the Control of AIDS, NACA, be getting ready for a goodwill message. That's talking about Dr. Temitope Lori. After her, we'll be having the representative of Dr. Walter Kazadi Mulombo, the WHO country representative, who is ably represented by Dr. Isiaka Ayodeji, the zonal coordinator. And please let Dr. Leo Zekeng, the country director for UNAIDS, who will be represented by Dr. Temitope Fadia, to also get ready. The First Lady of the Federal Republic of Nigeria is having a conversation with the couple, who has also said that today they are happy that they are famous and they are not dead. I think we should put our hands together for them once again. It is indeed an encouragement that you should know that HIV/AIDS is not a death sentence. Thank you very much, Your Excellency, the First Lady, Federal Republic of Nigeria. Everyone, now it is time for goodwill messages, and the first on the list is the Director General, National Agency for the Control of AIDS, NACA, Dr. Temitope Lori.
Good morning, distinguished excellencies, ladies and gentlemen. Your Excellency, the First Lady of the Federal Republic of Nigeria, the chairperson of the Renewed Hope Initiative, our own mother, Senator Oluremi Tinubu, CON, Your Excellency, the wife of the Vice President and Deputy National Chairperson of the Renewed Hope Initiative, Ajia Nana Shetima, Your Excellency, sir, our host of the day, the Executive Governor of the Sunshine State, Dr. Lucky Orimisan Ayedatiwa, and your lovely wife. Thank you for hosting us. All First Ladies here present, the Minister for State for Health, my Oga, Dr. Adekunle Salako, and all other distinguished ladies and gentlemen. Please permit me to stand on the already established protocol. It's always a privilege to stand before you on this podium to talk about the triple elimination of HIV, AIDS, syphilis, and hepatitis. I bring you greetings from the National Agency for the Control of AIDS, NACA, and I would also want to appreciate all the stakeholders at the state, because since my arrival at the state, I've met with the SSG, who is hesited, the SA2 Health, the Director General of the Contributory Health Insurance Agency, Permanent Secretary, Minister of Health, Permanent Secretary, Hospital Management Board, and what were we deliberating on? And of course, my brother in the Ondo State Agency for the Control of AIDS. And our deliberation is to ensure that no child is born HIV positive. I'm happy with the statistics, but you know the statistics does not cut across every nook and crannies. And from the previous statistics, you realize that the antenatal, coverage in Ondo State and even in the Southwest is still not optimal. So we still have our job cut out for us, and I would not want us to rest on our ears. Together yesterday, we inaugurated the Prevention of Mother-to-Child Transmission and Pediatrics ART Committee, Acceleration Plan Committee. And that is to say that we know we are all doing a bit, but we need to accelerate. We need to increase the tempo. We need to be more intentional, particularly with the changing landscape, as alluded to by the survivors. A lot of changes are taking place. Many of our implementing partners are not as funded by donor partners as they were. So this is the time for the state to be very intentional, to have budgetary allocation for HIV in terms of test kits, in terms of providing other services to them, in terms of counseling, and also to create the necessary enablement to prevent stigma and discrimination. At the national level, anti-stigma law was inaugurated or enacted as far back as 2014. I'm happy that that law exists in Ondo State, but we're saying we need to implement it for those that continue to stigmatize against people. But more importantly, we need to create the awareness. We need to educate our people, because many times stigma is as a result of fear, is as a result of unknown. So we need to create that awareness. We need to educate the public, and we have to actually go on air, use our various platforms to create that awareness. In NACA, we are collaborating with the National Orientation Agency to provide jingles and dramas and role plays, and this will be aired in every local government of the Federation, and is also being translated even to the local dialect to ensure that we pass the prevention messages across, because it's good to treat people, and the survivors have given testimonies of being on treatment, but more importantly, it's better to prevent, because it said that prevention is always better and cheaper than cure. So we need to educate our young ones, because of the success story we've had. You can see that some people have been living with HIV/AIDS for over 30 years, some 20 years, some 50 years. So many of the youth, many of the young ones do not even know how somebody with AIDS now, full-blown AIDS, look like. When we were training in medical school, you can smell AIDS from a kilometer, because you see them wasted, almost drying up, dying, with so many other clinical features that nobody wants to have. But now, because people are on treatment, people don't even know what it means to have HIV, what it means to have AIDS. And what am I trying to say? We need to prevent it. We need to educate the young ones, educate everybody in the rural areas, in the urban areas, about some of the ills of HIV/AIDS, and ensure that we find them and we put them on treatment for those that are positive, and we continue to ensure that they stay on treatment. Also, we need to empower our local government committees against HIV. We have LACAs at local government level, in all local governments, 774 local governments. I'm using this medium to appeal to Your Excellency and every excellencies here present. Let's go back and empower, because these are the people that are closest to the grassroots. Let's empower them so that they can actually take the message out there. And I'm very happy that Our Excellency, the First Lady, met with the traditional rulers yesterday, because these are also very major stakeholders in the campaign against triple elimination. I'm hoping that they will also use their resource and also the spiritual leader, to carry this message along. In closing, I want to say that also contributory pension scheme is very important. Like I said, I met with the DG of Ondo State Contributory Pension Scheme. I'm happy that he told me that they're already onboarding 1,000 persons living with HIV on the insurance scheme. But this is funded by donors. So now we have to be intentional, like I keep saying, we have state ownership, and we want to appeal, sir, and to all excellencies here present, that we should take the people living with HIV/AIDS as a vulnerable group under the contributory pension scheme. In closing, I want to say that let's continue to work to strengthen our resolve to ensure that no child is born HIV positive. Thank you, and God bless the Federal Republic of Nigeria.
Thank you very much. Please let's put our hands together once again for the Director General, National Agency for the Control of AIDS, NACA. Thank you. Please, can we now have the representative of Dr. Walter Kazadi Mulumbo, WHO Country Representative, Dr. Isiaka Ayodeji, the Zonal Coordinator. Please put your hands together for him as he comes to the microphone.
Your Excellency, the First Lady of the Federal Republic of Nigeria, Senator Oluremi Tinubu, our dear mother, the wife of the Vice President, His Excellency Aja Nana Shatima, the Coordinating Minister of Health and Social Welfare, ably represented here by my brother, Professor Salako, and I can also see my ED, National Primary Care Development Agency. The Executive Governor of Ondo State, His Excellency Honorable Lucky Orismison Ayedatiwa, and the First Lady of Ondo State, Mrs. Oluwaseun Ayedatiwa, the Executive Secretary of Offland, Dr. Nados Bahano, the heads of agencies, and other dignitaries that are present here, distinguished ladies and gentlemen, the members of the press. Let me bring you greetings from my country representative, Dr. Walter Kazadi Mulumbo, who seriously tried to be here today. And in fact, as I'm talking to you now, is around Futa area. It was because of certain logistic delay that caused his not being present here. So he has asked me to please read his message here on his behalf. Kindly permit me to read it. He said, I highly appreciate the First Lady of Nigeria, Her Excellency Senator Oluremi Tinubu, CON, on this honor to participate in this occasion. And that WHO congratulates the Organization of African First Ladies for Development and Nigeria on the triple elimination campaign of mother-to-child transmission of HIV, AIDS, syphilis, and hepatitis. The Southwest Zone, I understand, is the 5th in Nigeria to adopt this initiative, which is highly notable, and the First Lady's actions inspired national progress, setting a powerful example for health advocacy across the country. And I'm happy and glad to hear the good story about what Her Excellency has done yesterday. To underscore the significance of maternal and newborn health, the World Health Organization commemorated the 2025 World Health Day on 7th of April and is executing a year-long campaign with the theme, Healthy Beginning, Hopeful Futures, as the health of mothers and babies affect every single one. Yet millions lost their lives each year to preventable causes, consequent to lack of timely and high-quality care. We are grateful to the First Ladies, for amplifying the theme of this year World Health Day celebration, which resonated with the Renew Hope initiative and the Renew Hope agenda of Mr. President, as well as Nigerian Health Sector Renew Investment Initiative implemented throughout the sector-wide approach. I want to say that achieving and maintaining triple elimination requires strong political and public health commitment to developing and sustaining resilient health systems. We urge that the campaign be tailored to the unique needs of women and children in Southwest Zone through client-centered services. The First Lady, championing of public health initiatives, has promoted this campaign's efforts across zones, driving inclusive and impactful change. We are most grateful to you, ma. We call on leaders in the Southwest Zone and beyond to seize this moment, harnessing the momentum created by the First Lady, public health leadership, to achieve a healthier, disease-free future for all Nigerians. I also call you to support LGA structures to take health services to grassroots levels. WHO, through his triple elimination initiative, remains fully committed to supporting Nigerians' effort. We stand ready to partner with all the 36 and the FCT governments to eliminate vertical transmission and enhance health outcomes for the mothers and children. Yesterday, I was discussing with the DG, NACA, and I told her that we have at least nothing less than 10 community informants per each ward in Nigeria, meaning that these core people can also support this noble initiative. In conclusion, once again, congratulations to Upland, the Federal Republic of Nigeria, the First Lady, the Governor of Ondo State, the Coordinating Minister of Health and Social Welfare, and all distinguished persons that are here present for advancing this bold initiative in Southwest Zone and across Nigeria. Thank you, and God bless you for giving us this opportunity.
Thank you very much for the goodwill message. Next is Dr. Leo Zekeng, who is unavoidably absent but ably represented by Dr. Temitope Fadia. Please, let's celebrate him as he comes to the microphone.
Goodwill message for UNA's country director, Dr. Leo Zekeng. Your Excellency, First Lady Federal Republic of Nigeria, Senator Oluremi Tinubu, Your Excellency, the Executive Governor of Ondo State, our own Dr. Lucky Aiyedatiwa, all Excellencies here present, distinguished ladies and gentlemen, please permit me to stand on all existing protocols duly established. UNAIDS would like to take this opportunity to commend Her Excellency, the First Lady, Federal Republic of Nigeria, and members of our great team on the OFLAD Free to Shine campaign. As repeatedly reiterated by Her Excellency, the Free to Shine campaign is an advocacy. UNAIDS would like to point our attention to the significant contributions of strengthening leadership and management practices towards boosting HIV service delivery. Globally, cities are already taking the lead in responding to the triple elimination, which has repeatedly been reiterated by Her Excellency, the First Lady. The triple elimination of HIV and AIDS, syphilis and hepatitis as an integrated intervention. There has also been a gradual, substantial contribution to this intervention by state government. And we can cite quite a lot of examples. And not to be partial, I'm from the Lagos Field Office of UNAIDS. Substantially and on an incremental basis, Lagos has been like a shining light and a trailblazer. And I know the same thing applies to Ondo State. So according to Dr. Zekeng, the question before us now is what percentage of the state budget from all our excellencies that are here seated, what percentage of your state budget is appropriated and released to tackle the triple elimination of HIV, syphilis, and hepatitis? I would also like to use this opportunity to spotlight and to encourage all states to look in the direction of family life HIV education. That is, integrating HIV education into basic social sciences and social studies to ensure that boys and girls are retained in school and they learn the ABC of HIV prevention. At this point, I would like to personally commend the excellencies here present, the governors of the Southwest, for the great work currently being undertaken at the various SACAs and the Ministry of Health to increase their focus on prevention of mother-to-child transmission, pediatric AIDS case finding, and enrollment in ART care and support programs. Lastly, UNAIDS will continue to work with the Office of the First Lady, the Renewed Hope Initiative, to provide the much needed technical support at both the national and the state level in the area of HIV governance, health system strengthening towards supporting HIV sustainability implementation, HIV prevention, treatment care, and support services. I thank you all, and I wish you all the best. Dr. Leo Zikeng, UNAIDS Country Director. Thank you.
Thank you very much. A warm round of applause for him one more time. Thank you. And so, at this juncture, Your Excellencies, distinguished guests, ladies and gentlemen, I would like to invite on stage the members of the Nigerian Youth Service Corps for the presentation of their roles. A warm round of applause for them.
Oh, wow.
Hi, honey, how are you?
Sugarlistic, how are you?
I'm fine, oh. Hope
Wow,
you're okay.
I'm okay, baby.
All right. I have to go to work, okay?
All right.
I'll be back soon.
All right. Johnny Mercy, baby.
Okay.
Customer, how far now? Very good. Right now, let's okay. Sharp. Wait.
Don't worry. I'm coming.
What is happening? Okay.
Hello, Mr. Manogo.
Okay, good
How are you
morning.
doing?
I'm fine, sir.
Hope you are in a very good fettle.
As you can see.
How's your health?
Thank God.
Okay. I'm glad you're getting better. Okay, I think the second test result is out. And don't worry, just take it easy. Everything is in control. I think you are positive for HIV.
HIV?
Take it easy. That's not the end of life, Mr. Gbenga. Don't worry, I have an advice for you. Take it easy. You see,
at my young age.
It's okay. Being HIV positive, or if you get tested for HIV positive, that's not a death sentence. That is not the end of life.
Really?
I want you to understand that all you need to live a healthy, to live a good life has been put in place. In fact, we have over 21,000 persons who are domiciled in this state with this virus. And they are living very well, unperturbed, untroubled. I mean, you live your normal daily life. There's no cause for alarm, all right? In as much as you're taking your prescriptions, your drugs as prescribed by me, there is absolutely no cause for alarm, all right? The higher your viral load, the higher the risk of transmitting. But the lower your viral load, the lower the risk of transmitting. In as much as you're taking your drugs as prescribed, trust me, there's no cause for alarm. It is you equals to you.
Yes, doctor.
All right? There's absolutely no cause for alarm. All right? We're solidly behind you. The wall is behind you. Okay? This is your result.
Thank you, doctor.
Your Excellencies, distinguished ladies and gentlemen, I think the short play we just acted or staged here concerns virtually all of us, regardless or irrespective of your sex, your age, or your status, particularly our teenagers. Let me succinctly underscore or accentuate 3 cardinal points: A, B, and C. A has to do with abstinence. It is very pertinent, it is very important, it is a necessity that you abstain yourself, most especially as one who is not married or who is not in any form of relationship. It is important for you to abstain yourself. Now, point B, it is important for you to be faithful if at all you are in any relationship. That should be non-negotiable. That should be prioritized. Be faithful to your partner regardless of whatsoever, regardless of the situation. Now, point C, you have to use protection. You have to use condom, regardless of whatsoever, regardless of who the person is. HIV is not visible. HIV is not conspicuously seen. It is important for you to use your condom. Last but not the least, you can ascertain the HIV status or health status mere looking at anybody or mere looking at a person. The only way to ascertain or to know your health condition or your HIV status is to get tested. Thank you very much.
Thank you very much, the members of the National Youth Service Corps. We appreciate you. Your Excellencies, distinguished guests, ladies and gentlemen, next on our agenda is remarks, and I would like to bring to the podium Professor Ali Pate, Coordinating Minister for Health and Social Welfare. Please let's put our hands together, ladies and gentlemen.
Is ably represented today by the Minister of State, Dr. Isiaq Adekunle Salako. Please celebrate him as he comes to the lectern. Celebrate him, please. Celebrate him, please. Health is wealth, isn't that? Thank you very much.
Thank you very, very much. Your Excellency, First Lady of the Federal Republic of Nigeria, Chairperson, National Chairperson, Renew Hope Initiative, Her Excellency, Senator Oluremi Tinubu, CON, the wife of the Vice President and the National Vice Chairperson, Renew Hope Initiative, Ajia Nana Shetima, the wife of the Deputy Senate President, Her Excellency Ajia Lela Barau, Your Excellency, our host, the Sunshine Governor of the Sunshine State, His Excellency Dr. Lucky Orimison Ayedatiwa, and his lovely wife, Her Excellency Mrs. Oluwaseun Esther Ayedatiwa, the Deputy Governor of Ondo State and his lovely wife. Let me also recognize the wife of all other state governors here present, members of the National Assembly, wife of my colleague ministers, and all top government functionaries here present. Permit me to also recognize the energetic Ondo women, our youths, and the network of people living with HIV and AIDS, gentlemen of the press, ladies and gentlemen. On behalf of myself, the Honorable Coordinating Minister for Health and Social Welfare, Professor Mohammed Ali Pate, and all of us in the health sector in Nigeria, let me first and foremost appreciate Her Excellency, the mother of our nation, our own chief health champion, for the relentless commitment to bringing together key stakeholders in pursuit of the noble goal of improving the health and productivity of ordinary Nigerians. Your leadership, your passion, your dedication in this respect is an inspiration and is a catalytic formula that is helping us to get things done within the health sector. Your Excellency, Ma, you have been working in faith and undertaking journeys of mercy with success. We pray that this journey to elevate the health of our continent and our country will be another successful one. I also want to use this opportunity to commend and thank the wives of our governors across the country and the wives of other governments, top government functionaries, for heeding the call of our mother of the nation and working together with her to promote the health and well-being of our people. God bless you all for your dedication and service to humanity. Your Excellency, Ma, I wish to assure you that the Federal Ministry of Health and Social Welfare is inspired by your leadership, and we count ourselves lucky that the core agenda of the Renew Hope initiative is healthcare. Your Excellency has been communicating without any ambiguity that HIV, hepatitis, syphilis are preventable. And when prevention fails, none of them is a death sentence. We will continue to work with you to ensure the realization of the vision of the Renew Hope initiative. Nigeria is employing a multi-pronged approach to control HIV/AIDS, focusing on prevention, treatment, and care. This includes preventing mother-to-child transmission, voluntary medical male circumcision, social and behavioral change communication, and pre-post-exposure prophylaxis. We are testing, we are treating for other STIs, including syphilis and hepatitis. We are promoting the correct and consistent use of condom. We are addressing stigma and discrimination, and we are providing antiretroviral therapy for about 1.7 million Nigerians that are living with HIV/AIDS. We are determined, Your Excellency, and we are making progress in the drive to make Nigeria HIV-free. Your Excellency, distinguished ladies and gentlemen, let me use this opportunity to report back on the request by the representative of the network of people living with HIV and AIDS in Nigeria when the Free to Shine initiative was flagged up in Asaba, Delta State. The request made for free or heavily subsidized liver and kidney function tests for Nigerians living with HIV/AIDS is receiving the attention of the National AIDS and STI Control Program. The program is in the process of determining the quantum of people living with HIV and AIDS that are not covered by any insurance. And we are working with the National Health Insurance Agency to get such people covered so that they can enjoy the laboratory tests that they need without any financial hardship. I wish to assure all Nigerians, especially people living with HIV/AIDS, of the undiluted political commitment at the highest level of the federal government and adequate budgetary provision to sustain the national HIV/AIDS response. In the 2025 budget, adequate budgetary provision has been made to ensure we do not have any gap in the supply of ART drugs, reagents for testing, and other essential inputs. Under President Bola Ahmed Tinubu, GCFR, Nigeria is determined, and we are walking the talk to end HIV/AIDS as a public health threat by 2030. I use this opportunity, using Your Excellency, the Governor of Ondo State, to call on all state governments to join in this agenda of self-sustenance and domestic ownership of our HIV/AIDS response programs. Let us provide more budgetary funding at the state and local government levels, and also let us work with the federal government to absorb health workers at the risk of being laid off due to the dwindling external funding. In conclusion, I would like to appreciate our dedicated health workers who are the heartbeat of this campaign. I want to urge you to continue providing high-quality, patient-centered care to our citizens. I assure you of government priority attention to your welfare, your protection, and your job satisfaction. More importantly, I I am confident that God Almighty will reward you all beyond the imagination for your service. Let me use the significance of today, Good Friday, to inspire all of us to rededicate ourselves to service to humanity. I wish all of you, all of us without an exception, a happy Easter celebration. Thank you, and God bless the Federal Republic of Nigeria.
God bless you too, Dr. Isiaq Adekunle Salako, the Honorable Minister of State for Health and Social Welfare. We appreciate you, sir. Our regards to Dr. Ali Pate. Your Excellency, the First Lady of Nigeria, Your Excellency, the wife of the Vice President, and all other parts of the protocols I respectfully observe. At this point, may I bring to the microphone the 7th Executive Governor of Ondo State, our own dear Governor, Mr. Performer himself, the ambassador of our ease, His Excellency, Dr. Lucky Orimisun Ayedatiwa. Please let's put our hands together, ladies and gentlemen, for the People's Governor. Thank you, Ondo State women. Thank you. Thank you. We are running out of time. Thank you.
Thank you. The First Lady of the Federal Republic of Nigeria, Her Excellency Senator Oluremi Tinubu, CON, who also is the National Chairman, Renew Hope Initiative. I recognize you and I welcome you once again. Let me also pay my regards to the wife of the Vice President, Her Excellency Hajia Nana Shatima. You're welcome to Ondo State. Thank you for joining us today. Glad to see you. Let me also pay my respect to the wife of the Deputy Senate President, who has been with us since yesterday, Hajia Leila Barau. You're welcome. I would like to also acknowledge the Honorable Minister of Health, who is not here in person but being represented by the Minister of State for Health, Dr. Adekunle Salako. I recognize you. Let me acknowledge all the First Ladies, the wife of my brother governors, all across the 6 states of the Southwest and from other geopolitical zones that are here. Starting with my own wife, the First Lady of Ondo State, Her Excellency Oluwaseun Esther Nike Ade Ayedatiwa. Happy wedding anniversary. Thank you. Let me recognize the wife of my brother governor from Ekiti State, Her Excellency Dr. Olayemi Oyebanji, the wife of the governor of Osun State, Her Excellency Chief Mrs. Titilola Adeleke, wife of the Governor of Oyo State, who is also the coordinator for Southwest Zone, Her Excellency Engineer Tamundo Minini Makinde. The wife of the Governor of Center of Excellence, Lagos State, Her Excellency Dr. Mrs. Claudia Ibijoke Sanwo-Olu. The wife of my brother governor, I always call him Egbon, of Ogun State, Her Excellency Mrs. Bamidele Abiodun, good to see you. The wife of the governor of Gombe State, Her Excellency Hajia Asma Inua Yahaya. The wife of the governor of Jigawa State, Her Excellency Hadiza Umar Namadi. The wife of the governor of Kaduna State, Her Excellency Hajia Hafsat Ubasani. Let me also greet specially the wife of the governor of Borno State, Her Excellency Dr. Fatima Babagana Umar Zulum. And the wife of the governor of Nasarawa State, Her Excellency Hajia Salifat Abdullahi Sule. Let me acknowledge my loyal deputy governor and his amiable wife, Dr. Olabi Adelami, MNI. And Yeye, Mrs. Abosede Adelami, I recognize you. Let me also greet all members of the State Executive Council that are here, the Secretary to the State Government, Dr. Taiwo Fasoranti, the Chief of Staff to Mr. Governor, Prince Segun Omojua. Let me also acknowledge all the wives of members of the National Assembly, the senators and House of Representatives in your large number that has joined our First Lady to be here in Ondo State. I recognize every one of you, wife of the senators, wife of ministers, wife of members of the House of Representatives. Thank you so much for coming in your large numbers. Let me also acknowledge one of our own who is serving with the President in Abuja, Barrister Yejide Ogundipe, SSA, to Mr. President on food security. I recognize you. All, party chairman, I greet you. The chairman of the largest party in Africa, Ondo State Chapter, Engineer Adetimehin. Party is supreme, so I pay my respect. Without the political party, I can't be here. Thank you for coming and for all the work you are doing with us. Let me acknowledge also all chairmen of agencies, board and parastatals, all permanent secretaries that are here, all government functionaries here in Ondo State and outside Ondo State, wherever you are. I recognize every one of you. All head workers, members of Youth Service Corps, I recognize every one of you. Our Ìyá Lodgers, Ìyá Alájẹ, gbogbo yín ni mo kí o, gbogbo ìgbà. Mi ò rí yín kẹ́ stand by o, gbogbo ìgbà. Ẹ̀yin ìyá ẹ lọ sọ́ lọ́jà, mo kẹ́yìn náà o. Ẹ lọ sọ́ lọ́jà. Àní ẹ lọ sọ́ lọ́jà. Pé màmá wa wà l'Ondo State, ẹ lọ sọ́ lọ́jà. All our religious leaders, the chairman of Christian Association of Nigeria, who is represented by his vice, I recognize you. Our Muslim leaders, the Chief Imam of Akure Kingdom, I recognize you also. All our service chiefs that are here in Ondo State, and the wife of service chiefs, I recognize every one of you. Pardon me, please. All our students, all head workers, I recognize every one of you. Thank you for the good job you are doing. Distinguished ladies and gentlemen, we all in Ondo State, not just me as a governor and my deputy, we are all delighted to have the First Lady of Nigeria with us here for 2 days. We are so delighted and excited. Thank you so much. Especially kò tẹ́ ẹ lè sábà wọn ẹ mọ̀gbà tán ti ń bọ̀ ni First Lady Lagos State for 8 years àbáwọn ò lè fẹ́ rí Senator fún ọdún 12 ń bò lẹ́ ti fẹ́ rábà wọn now the wife of the president. God be with you, man. That is a wise woman that builds her home. We are not just so excited and happy for these 2 days, but particularly for today, as we are flagging off this program, marking another milestone in the fight against HIV/AIDS, syphilis and hepatitis, elimination of mother-to-child transmission, and treatment of Nigerians born with HIV/AIDS. We heartily welcome you once again, ma'am, the mother of our nation, the First Lady of the Federal Republic of Nigeria, Her Excellency Senator Oluremi Tinubu, ONCON, and other distinguished guests and prominent stakeholders that are here, especially those that are in your entourage, to this occasion taking place here in Akure for the entire Southwest geopolitical zone. Her Excellencies, distinguished ladies and gentlemen, it is salutary that this program being flagged off today in the Southwest is very timely, well crafted and planned to provide a cutting edge for our country, most especially at this period when most developing nations in Africa are experiencing anxiety and uncertainty over the decisions of the United States since the assumption of office by the new president, Donald Trump. United States has been one of the major donors to this health program. With this decision of trying to halt the provisions of AIDS and relief for people living with HIV/AIDS, that has been creating a lot of uncertainty in the minds of our people, not only in Nigeria, entire African country. Just like what I've been advised by the earlier speakers, especially the Minister of State for Health, that we should own it, this program. The government should make budgetary provision for the support now that some kind of supplies will be cut off from what we are hearing and what we are seeing. Also, Dr. Ilori also said same, and I want to assure you that here in Ondo State, we will review our budget. Some jobs have been lost by that pronouncement, as we heard from the chairperson of people living with HIV network. We have an agency in Ondo State already, Ondo State Agency for the Control of AIDS, ODSACA, that have been put together to mentor, advise, and look out for those who are living with HIV/AIDS, so that the government can reach out to them, and this we have been doing, and they have been doing a lot. That is why from that statistics you watched earlier on, Ondo State is not doing badly at all. But we will continue to intensify our effort to do more. So I want to use this opportunity to thank all the people in that agency under the leadership of Dr. Adegbolu. Thank you for the job you are doing. Just as we've also been advised that LACA should also be encouraged at the local government level. I've not actually looked at that direction before now. Maybe we have them at the local government level. But since it's been mentioned, that is noticed, and we will look into it so that also at the local government level we can replicate what we are doing at the state level. It is also remarkable that the flag off of Free to Shine is a triple elimination campaign of HIV/AIDS, syphilis, and hepatitis among women of reproductive age, elimination of mother-to-child transmission and treatment of Nigeria born with HIV/AIDS in the country. These are some of the greatest challenges confronting our society, particularly our women. Your Excellency, we commend you for this great initiative. We are grateful for counting on Ondo State worthy to be at the forefront in this laudable program. Your Excellency, let me say with all sense of responsibility that your Renew Hope initiative is a testimony of your support and fight for the cause of women in our country. The initiative, which also now encompasses the fight against the scourge of mother-to-child transmission of HIV/AIDS and enhancing access to treatment for Nigerian children living with this deadly disease, should be fully embraced by all and sundry. This awareness should not end in this hall. We should create more awareness, every one of us. Today's ceremony therefore marks a reinforcement of the ideals of compassion, service, and equity that define the administration of the President, our President, President Bola Ahmed Tinubu, GCFR, and your esteemed self, Her Excellency, the First Lady, which has continued to inspire millions of Nigerians, particularly our women and children. Her Excellencies, distinguished ladies and gentlemen, today, as we flag off the triple elimination campaign, we do so with the hope that no woman will have to fear preventable disease during pregnancy. We hope that no child will inherit a burden that science has already conquered. And we hope that through sustainable partnerships among all levels of government in Nigeria, we will build a healthier and stronger country. Once again, on behalf of the good women and people of Ondo State, we thank Your Excellency, the First Lady, and all stakeholders for your unwavering commitment and for bringing Renew Hope initiative to our state. God bless the Federal Republic of Nigeria. God bless Ondo State. God bless all of us. And I also wish us, everyone, a happy Good Friday and Easter celebration. Thank you.
Please let's celebrate His Excellency, the Governor of Ondo State, Honorable Lucky Orimiso Ayedatiwa. Please celebrate him, celebrate him. Thank you very much. Please let's be seated. Just before we get to the climax of today's engagement, please let's
Thank you very much. Before we get to the climax and peak of today's engagement, let's quickly have a moment of a rendition by one of our very vibrant, brilliant and beautiful students in Ondo State. We are not just champions in the health sector but also in the education sector. Please let's welcome Oshaduba Oluwatomi Leye from Ijapo High School. Please, I like to implore us, let's get our seats well placed though, so that we won't be swept off our feet. It's going to be very wonderful. Are you ready?
Obìnrin ni mí, mo pé lọ́lá. Obìnrin ni mí, máa rìn máa ṣoge. Máa rìn gbẹ̀rẹ̀ bí ẹni ẹ̀gbẹ́ ń dùn, máa tún ṣapá gẹ́gẹ́. Èmi lolùrànlọ́wọ́ ọkọ èmi ni. Èmi láńgẹ́lì ọmọ Èdùmàrè ló mọ̀ mí. Mo fi gbogbo ara ṣẹwà ẹlẹ́dàá mo dúpẹ́. Kò sáṣìṣe ní ìṣẹ̀dá mi, ẹ bá mi yọ̀. Mojúbà kọ́dá ayé, aṣẹ̀dá ohun gbogbo. Ọba tó fún mi láǹfààní láti tún lè fi ewì kọrin ìkìlọ̀ fáwọn ọmọ aráyé lọ́jọ́ tòní. Àkọlé ewì mi ni farabalẹ̀ gbadé. Ìrínisí ni ìsọnilọ́jọ̀, ṣóhun làwọn àgbà wí. Oge àṣejù tí ó kún ayé bí ẹ̀gbin oníyòrò, tí ó sọ ọ̀pọ̀lọpọ̀ ọ̀dọ́ di wèrè ọ̀sán gangan. Irun torí kún, wá ní wọ́n ṣe dreadlock. Aṣọ tọrùn fàya, wá ní wọ́n wọ crazy jeans. Ìkúnlẹ̀ abiyamọ o, ọmọlúàbí di wèrè ń bọ̀. Agbọ́ ti ọ̀ṣọ́rọ̀ ọlọ́mọge tí kò rí wèrè bíi ti ẹ̀gbẹ́ sílé. Èwo wá ní tadélébọ̀ tí fọjọ́ ogbó ṣe wèrè kiri ìgboro. Ògbórí eégún bá ọjọ́ dùndùn nílẹ̀ Ìlọrin. Wọ́n múra tán, wọ́n sì dàbí wèrè ológe. Ṣé ọ̀làjú lèyí náà àbí agbówèrè? Ẹ wò ó, ẹ mú tákàndá, kí ẹ mú gègé yín, kí ẹ súnmọ́ mi síbí, kí n di olùkọ́ ẹ̀kọ́ ìwọ̀ ọ̀sán gangan, kí ikọ́ yín bọ́mọlúàbí ti lè gbélé ayé tí ó fi di ẹni àpèsìn láwùjọ. Àkọ́kọ́ ni ìmúra ọmọ ènìyàn nílé ayé, ká pàdé ọmọkùnrin, ká sì máa fi wúre ọmọ, tàbí ká rìnà kọmọbìnrin, ká kẹnu bàdúà. Èwo ni ìmúra lòdìlòdì bí takọ bí wèrè? Ẹ̀yin obìnrin o, ẹ jẹ́ ká farabalẹ̀ gbadé. Má tara rẹ̀ lọ́pọ̀ nítorí àti lọ́kọ, má lura rẹ̀ ní gbàǹjo nítorí àti gbadé. Má kánjú lábẹ́ gbígbóná, irú rẹ̀ á máa láni láhán, irú rẹ̀ á máa jóni lẹ́nu. Ìwọ ní ọjọ́ ń lọ tàbí kí ló wí? Ìwọ gbàgbé pé onírúurú akọni ń bẹ, ìwọ gbàgbé pé onírúurú ọkọni ń bẹ. Bólówó tí ń bẹ, láláwìn ń bẹ, bónísùúrù ń bẹ, lálágídí ń bẹ. Oníranù wọn ò ṣe é kà, ìwọ̀nba péréte lọmọlúàbí láàrin wọn. Irúkírú yìí sì ládé orí abo. Adé wo ni wọ́n fẹ́ gbà ó jàre? Adé pẹrẹsẹ tàbí adé gogoro? Adé tó dípẹ́tà tàbí adé tó ń kọmọ̀nà? Adé olómi wúrà tàbí adé olómi góòlù? Adé rere tàbí adé rédèrèdè? Èyí ó wọ̀ ọ́ ló yàn, àmọ́ bádé bá fi dórí tán, àǹfààní àyàn òmíràn ò sí. Bó o fà á kékọ́rí, bó o yàn mìíràn, wàá sọ ọ̀rẹ́ di bọ́ọ̀lù táyà tẹ̀rọ ń gbá. Olóòyàn mìíràn dandan, wàá sọ ààrẹ di fìlà táyà tẹran dé wò. Àwa ti ṣe tá àfimọ́rú adé tó yẹ ni, àwa ti ṣe tá òfin ní ṣe adéyàn. Bẹ́ẹ̀ lábí ni, torí ojú là mọyán tí òyò ni, ojú tí ó sì bá nìyàn kalẹ̀ kì í fi tàárọ̀ ṣe bàìbàì. Má kánjú gba adé, má kánjú yan adé, má sì kánjú dé adé. Mo kí ìyá mi, Sẹ́nitọ́ Olúrẹ̀mí Tinubu, ọmọ Ẹ̀gbá Lísàbí, ọmọ Ẹ̀gbá gbogbo àkàlà, ọmọ ìrìnjogún ọlá, ọmọ òṣìlẹ̀kùn palẹ̀kùndé, ẹni dúdú òsì nílé, ẹni pupa tó wà nílé ò mọ bẹ́ẹ̀ sè. Ẹ̀gbá ò ní bàjẹ́, Oǹdó ò ní bàjẹ́, Nàìjíríà ò ní bàjẹ́ lásìkò tí ẹ káàbọ̀ sáàrin wa. Abánita ló fi ewì kọrin ìkìlọ̀ fáwọn ọmọ aráyé lájọ́ tòní. Èmi ni Olúwatómiláyọ̀ ọmọ Ọ̀ṣàdúgbà Àkànkẹ́ Akéwì. Ẹ ṣeun.
Wow. Màámi ní kọ́ ọmọ ọbọ̀. Ẹni pé mi kò ṣèbọ̀ mọ́ màámi ní kọ́ ọmọ ọbọ̀.
That's such a beautiful one. It's quite
The First Lady, Federal Republic of Nigeria, is acknowledging what?
It's so intriguing. And such display of talent.
Wow, wow, wow.
It's a huge display of
Please
talent.
celebrate this young girl. Celebrate her.
Amazing.
It's amazing.
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 Mama Eshe Púpọ̀.
And I love the fact that Our Excellency celebrates this very wonderful thing. Now, ladies and gentlemen, it's time for the peak of this engagement to welcome with me the First Lady, Federal Republic of Nigeria, and National Chairman, Renewed Hope Initiative, Our Excellency.
Thank you very much. I think this is the icing on the cake for me. Icing on the cake. The Bible will say, out of the mouth of babes and sucklings, God will ordain perfect praise. And I'm glad that our youth, you're all in this hall, including anybody above 64. You are a youth. At 64, you see that I still look like a youth. And our child has spoken today. And I think we get it. What she's saying is, what about you, married women, that you will now be acting like a babe? So I've just put it in a narrow form, because I'm not, but she really spoke to us today. Spoke to us, and I think we've all gotten the message. Did we all get the message? Because once I spoke it, you know, social media, they will hit back. You know, I have a daughter who models, but you know, we just put her away because this work is very intense. So, but you know, the culture where she's raised, she didn't see any reason why, because of her, you know, the craft she has chosen. They lashed that at me, but you know, I won't remove the log out of my eyes and be looking for specks in people's eyes. I spoke to her, but she learns to make wiser decisions. She's grown, but you know, we want people, I dress decently, you know, and I believe that beauty comes from within. You know, it's not what we look like. It's the way we carry ourselves. If we are clean cut, people will notice. I even heard now that when boys want to marry girls, they will say, okay, remove your makeup, let me see what you look like. So, but you know, fashion is good. I love fashion since I was very little. But at the same time, it would never define me. Thank you so much. What is the name of our daughter again? To rántí orúkọ ọmọ tó sọ̀rọ̀ bàbá. Ọ̀ṣà. Olúwatómiláyọ̀. Ayọ̀ ẹ̀ náà abẹ́ kalẹ̀ o. Wàá dàgbà wàá dògbò lórúkọ Jésù. Ìwọ náà wàá di ẹni tí à ń tọ́nà wò, a máa pé máa tọ́nà wò ẹ̀ ni. You reminded me of my daughter too. At very young age, she will mount the stage and she's like the center of the stage. And you reminded me of her. You can see the boldness. And she looked and Ọlọ́run ní gbóhùn ẹ o. Èṣù ò ní gbóhùn ẹ lọ́hùn kí Ọlọ́run tó fún ẹ lóhùn ó máa jẹ́ kí ohùn ẹ bẹ́ẹ̀ kalẹ̀ ni. Wà á dẹ̀ fi ṣe nǹkan rere lórúkọ Jésù. Thank you so much. It's been a wonderful 2 days in Ondo State. And I saw all my sisters that came with me. They are all looking fresh. Me too, I look well rested. Ondo has been a blessing. And God bless our governor and the wife. Thank you so much. The wife of the vice president. You know, I told you my sister is coming today. You see, she's here to also taste Ondo State, even if it's briefly. Wife of the vice president of the Federal Republic of Nigeria, Her Excellency Hajia Nana Shetima. The wife of the deputy Senate president, Hajia Leila Barau. The governor of Ondo State, His Excellency Dr. Lucky Orimisa Ayedatiwa. You know, each time I will almost go to my mother's dialect because my mom is Shekiri. You know, our dialect are similar. I will almost say Origo Misa. But he too has a Shekiri blood. So it's always, it reminds me of my own lineage and his lovely, lovely amiable wife, the First Lady of Ondo State, Her Excellency Mrs. Esther Oluwaseun Ayedatiwa. First ladies of other states and especially the Southwest here present, they've been calling you since I'm not repeating your names. Deputy Governor of Ondo State, His Excellency Dr. Olaide Adelami and his wife, Her Excellency Otunba Olubukola Adelami. National Assembly members here present, particularly Senator Adeniyi Adegbomire SAN, wives of National Assembly members here present, both in the Senate and House of Representatives, thank you so much. The Minister of State for Health and Social Welfare, Dr. Isaac Adekunle Salako, wives of honorable ministers here present, ably led by Hajia Bilikis Kiari, speakers of Ondo State House of Assembly, Right Honorable Olaide Oladiji, represented by Honorable Olawumi Fayemi Obayelu and other members here present, members of the Ondo State Executive Councils and Commissioners of Health from other states present, wife of the Chief of Defense Staff, Mrs. Ogogo Musa, wife of the Chief of Inspector General of Police, Mrs. Elizabeth Egbetokun, the wife of the DGDSS, Mrs. Charity Ajayi, wife of the Comptroller General of the Nigerian Customs Service, Mrs. Kike Lomo Adeniyi, the Executive Director and CEO, National Primary Healthcare Development Agency, Dr. Muyi Aino, thank you so much. APC Southwest Zonal Woman Leader, Mrs. Yetunde Adesanya, Ondo State APC Chairman, Engineer Adeti Meyi, and other APC members present. Development partners present, including WHO country representative, represented by Dr. Isiaka Ayodeji. Director General of NACA, Dr. Timitokpe Ilori, UNAIDS representative, Dr. Timitokpe Fadia. I bet Dr. Zeken did not send you some of the messages you delivered here today. Where are you? Because praising Lagos State and praising Ondo State, that's your own. Because your boss will say the way it is. But it's good to have you. I know you are based in Lagos. That's why you are trying to romance Mrs. Onwolu. National Coordinator, NASCP, Ade Bobola Basharon. National President of the National Council for Women's Society, Princess Edna Azura. The Chief Imam of Akure, Sheikh Abdullahi Akorede. The Khan Chairman represented by his Vice Bishop Ayodeji Akomolafe. Market leaders and market men and women present, nurses and midwives present, NYSC members here present, and thank you for the skit. Only that you just pulled, you wanted to blind all our young people here with the pull out of condom. You know, that was very bold. That was too much. But that's, you should mind your audience too. We are not introducing them to condoms yet. We are sticking with A, abstinence. Thank you very much. National Association of Nigerian Students, Ondo State Branch. My dear students here present, are there strong and brave survivors? Gentlemen of the press, distinguished ladies and gentlemen, I am honored to officially launch the Free to Shine campaign in Ondo State as I conclude a 2-day working visit to this Sunshine State. The Free to Shine campaign is an advocacy initiative led by the African Union, the Organization of African First Ladies for Development, OFLAD, and other global partners. The goal of this campaign is to address the growing complacency in the response to the spread of HIV/AIDS in Africa. Nigeria, being the country with the highest burden of HIV/AIDS in sub-Saharan Africa due to its large population, faces significant challenges. This burden is particularly severe among children, youth, women, and vulnerable groups. To complement the Free to Shine campaign, I've also decided to advocate for the triple elimination of HIV/AIDS, syphilis, and hepatitis by 2030. This campaign will cover the 6th geopolitical zone of the nation. Since the maiden launch in January 2025, we have so far launched the Free to Shine campaign in 4 zones, namely North Central, Northeast, Northwest, and South-South. Today we are flagging off the campaign in Ondo State for the Southwest zone. By the grace of God, the next and final zone to benefit will be the Southeast in Enugu State. The Free to Shine campaign seeks to significantly reduce new HIV infections among women of reproductive age, prevent mother-to-child transmission, which is also the vertical transmission, and ensure that every child born with HIV receives the necessary treatment and support to thrive. According to the Federal Ministry of Health and Social Welfare, in 2024, there were over 100,000 children and nearly 2 million adults living with HIV. Also, it is reported that most infants born to HIV-positive mothers are not tested within the first 2 months of birth, largely due to the fact that the mothers are not aware or they are ignorant of the consequences of their inaction. It is heartbreaking to know that just 2 years ago, 15,000 children aged 0 to 14 lost their lives to AIDS-related illnesses. Each of these children was not just a statistic, but represented a future full of potential that was sadly cut short. The ongoing challenges faced by these children emphasize the urgent need for sustained action to improve prevention strategies, enhance diagnosis, and expand access to quality treatment to ensure that no one is left behind. In Nigeria, hepatitis and syphilis are major public health outcomes. Experts highlight that hepatitis, especially hepatitis B and C, poses a significant threat as it can lead to chronic liver diseases and even liver cancer. If syphilis is left untreated, it can result in miscarriages, stillbirth, congenital abnormalities, and neonatal and infant deaths, among other complications. The goal of this campaign is to raise awareness, renew our commitment, and take collective action against these diseases. This, I believe, aligns with our shared vision of a healthier Nigeria, where every individual, particularly women, youth, and children, can thrive and live healthier lives. This vision is in line with the renewed hope agenda on health of His Excellency President Bola Ahmed Tinubu, GCFR, which focuses on health as an essential pillar of development. Nigeria is at a pivotal stage in her fight against HIV/AIDS and is poised and ready to join other countries in Africa who have achieved the UN AIDS 95-95-95 target by 2030. The aim of this target is to see that 95% of the people who are living with HIV/AIDS know their status. 95 of those who are aware of their status are placed on life-saving antiretroviral treatment, and 95% of people undergoing treatment achieve viral suppression, which means they cannot transmit the virus to others. We must deepen engagement with traditional and faith-based institutions to address cultural and religious influences on HIV prevention behaviors, especially those engaging in birth services. And I'm glad that Shehu is here, representative of CAN is here. I know that most churches do have clinics, but all this we have to make sure that they align with what the state government is doing and federal government is doing once they have birth, even traditional birth attendants. Please, we want you to pass the message. God will continually be with you. Amaso agbára yín dọ̀tun lórúkọ Jésù. I think I've spoken too much. So what we want you to do that for us, especially by expanding access to HIV testing services with comprehensive counseling, treatment and care for all individuals who test positive. I want to commend the association and members of the Association of People Living with HIV/AIDS for their testimonies. Their stories serve as a powerful reminder of resilience and hope, inspiring others living with HIV/AIDS to seek the support and treatment they deserve with courage and confidence. I thank all our health workers and National Agency for the Control of AIDS, NACA, National AIDS and STDs Control Program, as well as research and public health institutions for their efforts in combating HIV/AIDS, syphilis and hepatitis through the years, as well as global partners helping us in this fight. I especially recognize WHO, UNAIDS, UNICEF, UNDP, PEPFAR, and the Elizabeth Glaser Pediatric AIDS Foundation, amongst others. We must intensify efforts to ensure that the global triple elimination targets of HIV/AIDS, syphilis, and hepatitis is achieved by 2030. I believe that with the concerted efforts of all stakeholders here present, especially our state first ladies, who will help disseminate this message in their various states, this deadline can be attained by the grace of God, and I rely on you all to do the needful. I'm here to see your billboards. I'm here to see, yes, your billboards in your various states. It is very, very important. You can see the way the women are routing and cheering our first ladies here. You mean so much. Well, I've done my share in Abuja, and I'm expecting to see you all with your faces, because they recognize you more before they start looking for me, because you are the mothers of their various states. We want you to do that, and make sure that in your advert they have the numbers to call. Thank you very much. To our dear children and youth, this campaign cannot succeed without your involvement. You represent our future and the future of the generation of this country. However, your age group is one of the most vulnerable. Please take care and protect yourselves. I'm so glad that the governor brought all of you students here. My advice for you is to be careful. It's not only through sexual transmission you can contact AIDS. It could be sharing needles, sharing, sharp objects, and you all have to be very, very careful and also get tested, all right, from time to time. We have increased our advocacy in the media across all the 36 states by even saying that today and the Federal Capital Territory, and we hope it resonates. Before I conclude my speech, I'm going to start with the wife of the senator representing Osun Central, Mrs. Fadeyi. Happy birthday. Can you all, thank you. Can you sing for her, please? Happy birthday to you. May the good Lord bless you. May the good Lord bless you. May the good Lord bless you, we pray. May the good Lord bless you. Hooray. God bless you. And then to our Sunshine State Governor and his dear wife. Is God not good? God is good. They didn't pick this date for me, I picked it. And today, through the sheer grace of God, on a day, special holy day, Good Friday, which reminds us of the ultimate sacrifice of love, you are celebrating 27 glorious years. Marriage is tough. It has its up and down, but it is a blessing. The book of Ecclesiastes says 2 is better than 1. Why? They have a better reward for their labor. He said even if one fall, the other will help him up. And the cord of 3 is not easily broken. So God, with Jesus that you serve, will bind you together till you both see him in glory, in joy, in happiness, with peace, and we pray with fruitfulness in the name of Jesus. God will bless you. You are such a beautiful, beautiful couple. And I'm honored to stand here as one of God's servants to proclaim his blessing on both of you. God bless you, sir. I want to thank you for all that you did for us, all our entourage. Thank you so much. Yes. To God be all the glory. I especially appreciate my gratitude to you both and the good people of the Sunshine State for the warm reception and kind hospitality throughout our stay. We'll miss your state and we hope to be back. God bless you. God bless our children, youth, and mothers. God bless Ondo State. God bless the Federal Republic of Nigeria. Happy Good Friday and happy Easter in advance. Thank you.
Thank you very much. Now, let's celebrate the First Lady of the Federal Republic of Nigeria, Her Excellency, Senator Oluyemi Tinubu. Please, let's clear the foyer. It's time for photo sessions. Let's have the wife of the Vice President, Her Excellency Nana Shetima, the wife of the Deputy Senate President, Lalam Barau, Governor Lucky Orimisa Ayedatiwa, and his amiable, beautiful wife, Mrs. Esther Oluwaseun Ayedatiwa, the Deputy Governor and his amiable wife, the Minister of State, Health and Social Welfare, that the first round of pictures will be taken today. Thank you very much. Thank you very much. That's the first photo session. Are we done? Photographers, let's be fast about that. Thank you very much. Please, After this, let's have Her Excellency, the First Lady of the Federal Republic of Nigeria, Her Excellency Nana Shatima, the wife of the Deputy Senate President, Nana Barau, Governor Lucky Orisai, as well as his amiable wife, the Deputy Governor and his wife, the Minister of State for Health should also stay. Please let's have the Ondofe coordinator of the Renewed Hope Initiative, Dr. Shehu Bosade Osamae, also join the trail. Thank you. Thank you. Thank you. Please let's have the First Ladies of the Southwest, just the Southwest first. First Ladies of the Southwest. First Ladies of the Southwest. First Ladies of the Southwest to join this trail. First Ladies of the Southwest first. Just the Southwest first for now, please. Thank you very much. Can we now have other First Ladies join them? Other First Ladies. Other First Ladies. Your Excellencies, you all look beautiful. Thank you. Thank you very much. Can we now have just Her Excellency and then the wife of the Vice President, Her Excellency Nana Shatima. Let's have the wife of the Deputy Senate President with her. Let's have the Minister, Governor Idatu and his amiable wife. And then we have them with development partners. Development partners, please. Development partners. Development partners. Development partners. Okay. Thank you very much. Now next, let's have Her Excellency, with the wife of the Vice President, Nana Shatima. We have the wife of the Deputy President of the Senate, Barau, the Minister of State for Health, Governor Idatu and his beautiful wife, with core members. Core members, please, representative of core members. Thank you very much. Please quickly, can we have representative of the students? Please, let's quickly have the representative of the students, and then we have the religious leaders. Representative of students. representatives of the students are being attended to by Her Excellency the First Lady of the Federal Republic of Nigeria. Now we have the students. Thank you very much. Can we now have the religious leaders join the prayer? Mama Nico already. Religious leaders are now joining the prayer. Please let the health sector stakeholders quickly get ready. Thank you very much. Thank you very much. Last but not the least, the health sector stakeholders quickly, because health sector. Thank you very much. Can we now have the wives of ministers? National Assembly, please. National Assembly. Senators' wives and House of Assembly. House of Reps and Senators' wives, please let's come up now. Thank you very much. Next is wife of service chiefs. Wives of service chiefs. Please, can we have wives of ministers first before? Okay, service chiefs are ready. Thank you very much. Thank you very much, wives of ministers now. National Council of Women's Society. After this one, National Council of Women Societies, with their representatives, please, just their representatives. Kò lè gba gbogbo wa o. Thank you very much. Let's have the Ondo State House of Assembly Speaker, the State Legislature. Thank you. Ondo State members of Executive Council. Where is Dr. Shewa Samai? Okay, thank you. Thank you very much. 8th sector stakeholders in Ondo State. Thank you very much. Thank you, Your Excellency. Thank you. Thank you very much. Thank you very much, Your Excellency, the First Lady of the Federal Republic of Nigeria. Thank you, Your Excellencies, the First Ladies across the country. Thank you, everybody. It's been a very beautiful, wonderful moment. Espousing conversations around all of the things that will culminate into good health for our people. Thank you very much, all the civil society organizations. Thank you, everybody. Please, once the VIPs get to their seats, let's get ready for the Ondo State anthem and then the national anthem. Thank you very much. Thank you. Your Excellencies, distinguished guests, ladies and gentlemen, it's been a day well spent. Can we now have Ondo State anthem?
Shall
anthem. Because it is Southwest, I'd like to greet you, Adele Bareo, Arina Koreo. God bless you, safe journeys, and God be with you. Amen. Please, Mufta Aremush, you see us with an identity. We want to know if you are the true owner of what we have here. You lost something. Thank you.